The holidays may be the season to be jolly, but it's not always full of cheer for the 3 million Canadians who may have chronic obstructive pulmonary disease, or COPD, a life-threatening lung disease. In fact, lung attacks are at their highest levels during the Christmas period. Dr. Alan Kaplan, the director of the Family Physicians Airways Group of Canada, explains.
COPD is a progressive respiratory condition caused mostly by smoking that causes damage to the lungs and progressive blockage of the airways. The symptoms of COPD include cough, breathlessness, and sputum production. Sputum is the mucus we cough up from our chest. This often gets worse at times of respiratory infections, such as the cold and the flu. These worsenings of COPD we call lung attacks, and a severe lung attack can actually land someone in the hospital. At this time of year, holiday time, family gatherings, office parties, it's an opportune time for respiratory infections to be transmitted from person to person. This puts the COPD patient particularly at risk of a lung attack. We call this time the Christmas peak or Christmas epidemic of COPD hospitalizations.
A lung attack is often not reported to physicians by their patients because they go to walk-in clinics or to an ER, making it harder for doctors to recognize the frequency of their patients' flare-ups. Dr. Alan Kaplan says reducing the risk of hospitalization is achievable through better recognition and management of the disease. Thus, Health Canada's recent approval of DOCSIS, or roflumilast, is welcome news.
DOCSIS works by gradually reducing the COPD-related inflammation in the lung. When started early and added on to standard puffer therapy, it has the ability to improve lung function and reduce lung attacks, thereby reducing the risk of the patient going to the hospital with a lung attack.
DOCSIS is a selective inhibitor of PDE4, a new class of medication. It reduces the activity of PDE4, which results in less inflammation in the lungs. This helps to stop the narrowing of airways, which occurs in COPD. DOCSIS will help to maintain control of lung function and help protect COPD patients from flare-ups or lung attacks. Linda Walsh has been living with COPD for 8 years and has been hospitalized several times for a flare-up or lung attack.
I was diagnosed about 8 years ago. At that time, I was about 40% of my expected lung volume, and from then till now I've reduced to 23%. I know I've just gotten over a flare-up, and I coughed and nothing would move. Like most people, when they cough, stuff moves, so it works for them. But when I coughed, nothing happened. So it was just like gasping for breath and coughing and hanging on to stuff and turning red. And it was a pretty scary experience. It's something that I don't wish on anyone. So gradually over time, you lose your ability to do all those things that you like to do. I used to bike, I used to love walking, I used to jog even sometimes, but now I can hardly get across the street. If there was a drug available that would lessen my symptoms during a flare-up, I would definitely want it. And if it would actually prevent a flare-up, why not take it?
While COPD lung attacks are at their highest during the holiday season, a person with COPD continues to be at risk, especially during the winter months, since respiratory infections are more frequent. COPD patients should prepare carefully by reducing exposure to large crowded places, washing their hands regularly, and getting a flu shot. This is Martin Vanderwood reporting.